This is patient assessment medical.
Okay.
You have 15 minutes to complete this skill sheet. Do you have any questions?
Nope.
Okay, you are dispatched to a 56-year-old female with chest pain.
All right. So BSI is my scene safe.
Scene is safe.
That's my only patient.
Yes.
Nature of illness is chest pain. I'm going to consider additional resources, but we'll wait until after patient evaluation. And I'll consider C-spine precautions.
Okay. So you walk in, patient is sitting on the couch, kind of bent over in pain, holding her chest.
So general impression, somebody clasping on their chest is chest pain, and probably sick. Sick or not sick, go with sick. I'm going to check level of responsiveness as I introduce myself, see how they react, and I'm going to see if there are any immediate life threats and confirm what their chief complaint is.
Okay, you don't notice any life threats, and you confirm that she is alert for the level of consciousness, and her chief complaint is, in fact, chest pain.
Okay. So I'm going to start assessing her. I'm going to move into my ABCs. I'm going to check airway, make sure that she's breathing appropriately. And airway, if she needs it, I'll start administering oxygen. If she's complaining of shortness of breath or anything like that. And then circulation, I'm looking for any major bleeds. If she's got good skin color.
No, she is pale, cool, diaphoretic.
Pale, cool, diaphoretic. All right, so some diminished stuff there in the circulation. Based off the initial presentation there, this is going to be a rapid transport. You need to load and go and start moving. We'll be working as we move. Moving to this history taking. She's the only person in the house.
Yeah,
Okay.
she is.
To the best of her ability to answering questions, I'm going to go through my sample and OPQRST. Signs and symptoms: chest pain.
Yeah, she tells you that she has crushing chest pain.
Crushing chest pain. 10 out of 10.
Yeah, 10 out of 10.
All right, and then allergies, medications.
She's allergic to penicillin, and that's it. Medications, she has hypertension. She takes lisinopril.
Okay.
She tells you that she has had a heart attack in the past, and it feels exactly like this.
Okay, heart attack in the past. How long ago was that?
That was about 10 years ago.
Okay, is there any more pertinent medical history?
No.
Okay, so hypertension, heart attack, a few years back. Last thing she's eaten.
She ate lunch today.
Okay, and then events leading up to this, was she sitting when this started or
No, she was out gardening.
out gardening? Okay.
Yeah.
Cool. So I'm moving my OPQRST onset. She was outside gardening, developed pain. Provocation, toleration, anything make it better or worse?
Nothing's making it better.
Okay, quality is crushing already. It was related to pain. Does the pain radiate anywhere? Is it from the center of her chest?
It kind of goes up into her jaw.
Up into her jaw? Okay. And then how long ago did this start?
About 20 minutes.
20 minutes? Okay. So with that, I'm going to move into my vital taking. I'm going to start with a 12 lead, blood pressure, pulse, oxygen saturation, and then I want to get an IV started, at least one 18 gauge IV.
Okay, pulse 100
Okay.
and regular. Blood pressure 150 over 90.
Okay.
Respiratory rate was 22. Quality is good. Pulse oximeter is 94% room air.
Good. Patient's highly suspect for a cardiac event. I was getting a 12 lead.
Oh, yeah, 12 lead.
While they're doing that, I'm getting 4 baby aspirin on board.
Okay. What's your dose?
325.
Okay. 12 lead comes back. She has depression in V1, V2. With V5, V6 elevation.
Okay. And that's nothing in 2, 3 and foot or anything like that.
Nope. Unremarkable except for the depression in V1, V2, and elevation in V5, V6.
Okay, so we're giving her the aspirin. She's had a couple minutes for that to start working in her system there while we're getting the 12 lead on and sorted and taken. And so I'm going to move into nitro, sublingual And we'll have her take 1 sublingual nitro. We'll get
What's your dose?
0.04. 0.04.
Okay.
We're gonna go with NS for our fluid,
Okay.
and we're gonna get fluid started with 250 milliliter bolus, and we'll reassess after that. And so from there, she's taking nitro. Any relief of the pain?
Minimal.
Minimal.
8 out of 10
Okay.
now.
So we're gonna move into pain management with that. With our phone acronym, we're gonna use fentanyl, and we're gonna do 1 mic per kilogram to affect there.
She is 75 kilos.
75 kilos, so it'd be 75 micrograms of fentanyl.
Okay.
So we're gonna make sure that that's getting started there. Might even get some Zofran just to prevent any nausea or anything like that.
Okay, what's your dose of Zofran?
It's going to be, I'm gonna give her a tab at 0.4. Right?
At 0.4?
Yeah. For the sublingual tablet.
Okay.
I'll look at the case, and if I have any doubts, I'll make sure I double check with hand Tevi prior to any med administration if I'm uncertain. And so moving on from there, we've settled that oxygenation. It sounded like it was good, right? It was on room air. If needed, we'd supplement that. Like that field impression is MI. We're gonna get her moving to an appropriate facility.
Okay.
So,
All right, you're in cath lab's 5 minutes away.
okay, yeah, that's the facility we're gonna be going to. And then I'm gonna just reassess the patient. If needed and blood pressure allows it, we'll do more nitro to alleviate pain or possible damage through ischemia.
Okay, what's your max nitro?
It'd be 3 tabs prior to calling medical control.
Okay.
And then we'll get, just reassess vital signs, 12 leads. We'll run those serial and see if we're having effect.
Okay. Anything else you'd like to add?
Nope.